are going to help us pull that fluid off. Okay. All right. So let's go through some questions. You can, go ahead.
Sorry, for ICP, you mentioned 3 things. Head of bed, elevated head of bed, midline, and something else.
So supine, midline, and head of
Fine.
bed, 15 to 30 degrees.
30 degrees, gotcha.
All right. So first, we're going to do unit 9. That was heme onc, grief, and loss. So first question, which of the following indicates parent understanding of teaching for liquid oral iron supplements? A, I should take my child to the ED if his stools become dark. B, my child should avoid eating citrus fruits while taking these supplements. C, I should give the iron with milk to avoid an upset stomach. D, my child should take the supplement through a straw. So indicate parent understanding means we are looking for a correct statement.
D?
This is B.
I thought they had to have it through a straw for the teeth.
Yeah, when we're talking
No.
about the liquid iron, I didn't see who's talking, but what are we thinking? Why do we want to do through the straw?
For the staining of the teeth.
Perfect. Absolutely. All right. So we know that iron is going to cause those stools to become dark. That's not a concerning factor. We should also know, we talked about this last week, that citrus is going to help potentiate or increase the effects. So that actually would be something that that child could do. And we know that that milk is something that we want to avoid while that child is taking it because it's going to counteract the effects. So the correct answer is D, because that's going to help prevent the staining on the teeth. Very good. All right. What is the priority nursing intervention in the treatment of sickle cell anemia? A, start a central line to administer TPN. B, provide adequate hydration through, should say by mouth, or IV if necessary. C, obtain consent for a blood transfusion. D, begin pre-op teaching as the child will need emergency surgery.
B.
Absolutely. TPN is not going to do anything to help us, doesn't have anything to do with it. Blood transfusion may have to happen, but we want to try those other actions first. One of your classmates shared an acronym HOP to it with me last week, which means we start with hydration, oxygenation if necessary, and then P is going to be our pain control. That is the order of treatment when it comes to providing care for these children, because a lot of times that increasing that hydration, it may not take away the pain completely. It may not prevent us. It may not prevent us from going into that crisis, but it may help allow for an easier control. I was having trouble with my other screen. That's why I moved it, but I can move it back now. It seems to allow for that to work. Is that easier to see? I put it like that. Is that better?
It's still the same.
It's the same.
Oh, it's because
you had it bigger and then you went back to smaller.
It's because I didn't change that. There you go. How's that?
Better.
Okay, cool.
Perfect.
All right, so let's move on to our next one. What symptoms would you expect to see in a child with hemophilia? A, bleeding gums, epistaxis, hemarthrosis. B, decreased bleeding, poor growth, epistaxis. C, constant hematuria, limited range of motion, excessive pain. Or D, hemarthrosis, hyperkalemia, and bleeding gums.
A.
Everyone agree with A? That is the correct answer. When you're looking at a collection of symptoms, you have to make sure every single one of them is going to go with it. Okay. So A is the only one where every single thing works with it. We would expect increased bleeding. So that takes out B. Poor growth, epistaxis are things that we may see. Poor growth, we would associate that with chronic hemophilia related to that decreased oxygen. Constant hematuria, it's typically intermittent, but the bigger thing is not so much constant as that spontaneous. Limited range of motion, may or may not have anything to do with it. Doesn't tend to be a lot of pain associated with hemophilia. Hemarthrosis, yes. Hyperkalemia doesn't really fit in here. Bleeding gums, yes. So the only one that fits, that it's every single one of them is correct, is A. Very good. All right, a nurse is caring for a toddler with Wilms tumor. Which of the following actions should the nurse take? A, palpate the abdomen to determine the size of the tumor. B, prepare the child for surgery. C, teach the parents about dialysis. Or D, obtain a 24-hour urine specimen from the child.
B,
B.
Absolutely. We know that Wilms tumor is where? Where's our tumor at?
in the abdomen.
Right, it's our kidney, right? Remember, that's unilateral, doesn't cross that midline because it's only one kidney that's going to be affected. The only way that we're going to treat this is to remove that kidney, the affected kidney. We also know another priority nursing consideration with this one is because that all those tumor cells are encapsulated in that kidney. As long as we don't push on that abdomen, it's a pretty easy surgery, pretty easy type of cancer to recover from because all of the cancer is localized. The minute that we start palpating on that abdomen, what happens?
Okay. So metastasizes.
Yeah, we
It'll
push,
spread.
absolutely. We push those cancer cells out into the rest of the body, and that's going to make our problem a lot more difficult to correct. Very good. All right, what is the priority nursing action for a child following surgical treatment for a neuroblastoma? A, provide long-term IV antibiotics. B, initiate physical therapy to assist the patient in regaining mobility. C, preparation for a prosthetic device. Or D, provide pain relief and rest.
D.
D.
Absolutely. What is our neuroblastoma? Where's our problem?
In the abdomen, the belly,
Hmm.
like crosses the midline.
Absolutely. So it's in the abdomen. It does cross the midline. Remember, these children have a very poor prognosis because we call this our silent tumor. We don't typically realize that this child is sick until it's usually too late and that tumor has metastasized. Our priority actions, regardless of when we do diagnose it, it's going to be about pain relief and rest. Very good. All right, which of the following are early manifestations of leukemia? Is it A, hematuria, ulcerations in the mouth, B, anorexia, petechia, unsteady gait, C, prolonged bleeding time, blurred vision, D, skin eruptions, or headache? What's our best answer for early manifestations?
B.
Absolutely, the answer is B. Yeah, so anorexia, petechia, unsteady gait, all a little non-specific. Obviously, we're going to have to do some diagnostic testing. Hematuria doesn't necessarily fit in. Ulcerations are going to be more related to the chemo or those side effects of chemo. We're not going to see that as our early sign. Okay. Prolonged bleeding time has more to deal with. Hemophilia doesn't really fit in here. We're talking about vision changes. What type of cancer are we probably looking at?
Brain,
Could be brain or that retinoblastoma we talked about. Very good. Skin eruptions don't have anything to do with our leukemia. Headache could be related to the lack of oxygen, maybe, but that's a bit of a stretch, not usually one of our early signs. All right, which of the following instructions should be provided to the parents following chemotherapy? A, manifestations of infection, hand hygiene, bleeding precautions. B, bleeding precautions, homeschool, contact precautions. C should be a different answer, but I obviously messed that one up. D, homeschooling, reverse isolation, hand hygiene. Which one would we encourage?
A.
I say A.
Absolutely. B, you could probably figure out is not the correct answer since it's in there twice. Why do these children not have to be homeschooled? Why would that be counterproductive?
Would
It
be
won't
kind of
help
funny
build
when
their
they-
immune system. I don't know.
It actually is tied more to Erickson. There may be points during chemo when they need to be isolated. That's where that reverse isolation comes from. You know, we talked about neutropenic precautions last week. If they're at a point where their white blood cell count is at a minimum, we may need to homeschool them temporarily, but it's not something we universally want to put out there just because a child is getting chemotherapy. Because, I mean, this question doesn't tell you where the child's at with Erickson, but regardless, we know that his ability to interact with other children is going to be essential for his development. So there may be certain times that we have to be homeschooled or need to be separated from other children, but it's not something that we do for the duration of the chemo. Okay, so best thing is going to be about manifestations, the infection, what to watch for, those early signs. Remember, we have to be aggressive with our treatment because this child is not going to be able to mount his own immune response. Hand hygiene as far as that preventing infection and bleeding precautions, because that is an increased risk there. Okay. All right, which of the following are impending signs of death? A, heightened sense of hearing, B, tachycardia, C, difficulty swallowing, D, sensation of being cold.
C.
Everyone agree with C?
Yes.
Good, that is the correct answer. All right, we know that hearing is our last sense to go, but it doesn't necessarily mean that there's a heightened sense. We don't hear better, it's just the last sense to go. You know, we're more likely to see bradycardia as the body starts to slowly wind down. And that sensation of being cold, the patient themselves is actually going to feel warm. They're going to have a sensation of being hot. But if you were to touch their skin, they're going to feel cold. So it's important to make that distinction. Them feeling cold, that cold feeling, that pallor that you're going to see is related to their poor circulation, again, as everything starts to slow down. But the patient themselves, they feel hot. Okay. All right. Anybody have any questions about Unit 9 before we move on to Unit 10? All righty. Let's move on to neuro. All right. A nurse is caring for a patient with a decreased loss of consciousness. Which of the following priority actions should the nurse take? A, place the patient on NPO status. B, prepare the patient for a lumbar puncture. C, position the patient in a prone position. D, place the patient in a protective environment.
A.
I say A.
Absolutely. What's our concern? Why is A our priority?
Aspiration.
Absolutely. Very good. Yeah. Lumbar puncture may or may not happen if we haven't figured out what's going on with our patient. We could use that for diagnostics. Prone position we know is not going to help. We want that patient supine and midline. Protective environment is a potential. We could have a patient that could have a seizure, but priority action is going to be that NPO status. Very good. All right, a nurse is caring for a patient with increased ICP. Which of the findings should the nurse expect to see? A, depressed anterior fontanelle. B, constipation. C, presence of rooting reflex. D, high-pitched cry.
D.
Absolutely. D.
Desmond dog.
Yes, very good. We know, obviously, these are indicating signs in an infant. We're going to see that bulging fontanelle because of that increased pressure. Constipation doesn't really fit in. Presence of rooting reflex. Don't really know how old this child is, but that's really not going to be a good indication either. Okay, we know that feeding usually is not going to be a high priority for these children, so the likelihood of having that rooting reflex intact at this point is not likely. Best answer is high-pitched cry. All right, a nurse is caring for a patient with a myelomeningocele. Which point indicates the need for further teaching for the nurse? A, remind the mom that cuddling cannot happen safely until after surgery. B, avoid rectal temperatures. C, place the patient in a supine position. D, apply a sterile moist dressing on the sac.
I say A.
So indicates the need for further teaching means we're looking for correct or
C.
incorrect.
C. Because they'll bust the thing.
Yeah, so indicates the need for further teaching means we're looking for an incorrect statement. So cuddling cannot happen safely. Remember, our priority action for that myelomeningocele is integrity of that sac. So we're going to have to tell this mom about containment. We're going to have to tell this mom about those gentle things that she can do. But cuddling can't happen until we correct that. Rectal temperature is definitely something that we want to avoid because we could affect the integrity of that sac from the inside. We want this child in a prone position, again, to protect that sac. So supine is not how we want that child. Very good. A nurse in the ED is assessing a child following an NVA or motor vehicle accident. The child is unresponsive, has spontaneous respirations of 22 a minute, and has a laceration on the forehead that is bleeding. Which of the following actions should the nurse take? A, stabilize the child's neck. B, clean the laceration with soap and water. C, implement seizure precautions for the child. D, initiate IV access for the child.
A.
Everyone agree with A? Very good. Why is that so important?
Airway. And
Absolutely.
also might have a spinal injury.
Very good. Yeah, that's perfect. We want to prevent further damage if possible. All right. A nurse is caring for an adolescent who has a closed head injury. Which of the following are indications of increased ICP? So this is a select all that apply. So we have an adolescent. So A, report of a headache, yes or no?
Yes.
Absolutely. B, alteration in pupillary response, yes or no?
Yes.
C, increased motor response.
No.
What are we going to see instead?
Decrease.
Decrease. Very good. D, increased sleeping.
Yes.
Absolutely. E, increased sensory response.
No.
We see that decrease as well. Very good. All right, that is the end of neuro. Anybody have any questions about that section? No. All right, on to unit 11 and 12. This was endocrine, integumentary, and musculoskeletal. All right, a nurse is reviewing sick day management for a child with type 1 diabetes. Which of the following should be included in the teaching? Another select all that apply. So A, monitor blood glucose levels every 3 hours. Yes or no?
Yes.
That one's a little tricky.
No.
We know that a better
mean-
choice would be to monitor blood glucose levels more frequently.
Frequently.
Yeah,
Okay.
it would be helpful to know, I should change that. It would be helpful to know how often we're checking them in the first place. Biggest point here is that we need to check it more frequently. All right. B, discontinue taking insulin until feeling better.
No.
No, why do we not want to do that?
Because you might need an increase.
Yeah.
Absolutely. The inflammatory process, just the stress on the body from being ill is more likely to actually have us need more insulin, not less. C, drink 8 ounces of fruit juice every hour.
No.
Yes.
I would say
Depending
no.
on the sugar, right?
Yeah.
Yeah. What would be a better thing to have? I mean, hydration is important, but what would be better?
Water.
Water.
Yeah. D, test urine for ketones.
Yes.
Absolutely. We just covered that we are going to see an increase in the insulin that our body is using. So we need to check for those ketones to see if we're going into potentially DKA, for example. E, call the provider for blood glucose levels over 240.
Yes.
Absolutely.
I'd say yeah.
Yeah, that's very high. All right, very good. All right, a nurse is teaching a child with type 1 diabetes about self-care. Which of the following statements made by the child indicates understanding of the teaching? A, I should skip breakfast when I am not hungry. B, I should increase my insulin with exercise. C, I should drink a glass of milk when I am feeling irritable. D, I should draw up the NPH insulin into the syringe before the regular insulin.
D.
Yeah, D, cloudy you draw cloudy before clear, right? Or-
So understanding of teaching, we're looking for a correct statement. So should the child skip breakfast when he's not hungry?
No.
No. Should he increase his insulin with insulin?
No,
Oh,
No.
sorry,
no.
with exercise. Not necessarily. He wants to monitor his blood sugars, but just exercising doesn't
Maybe a
necessarily-
snack.
A snack
snack.
is a much better.
Yeah.
I don't know who said that, but that's a much better answer. What are we perceiving from C? What does that irritability tell you?
Low blood sugar.
Low.
Low blood sugar, absolutely. And that milk is healthy sugars that are going to help. In pH, we always want to do clear to cloudy. I think someone said that. So that's backwards. Very good.
Cloudy is clear.
All right. Which of the following are manifestations of DKA? Select all that apply. So A, blood glucose of 58. Yes or no?
No,
What's
Mm-mm.
happening with DKA? Is our sugar high or low?
very high.
Very high. High to the point that has made our patient most likely unconscious. 58 is not going to be that. We're looking 300s, probably 400s. Okay. B, weight gain.
Yes.
Yes.
I would say not, it's not really.
No, we're looking at an acute situation. Weight gain's not going to be a factor here. C, dehydration.
Yes.
Yeah.
Yes.
Absolutely. D, mental confusion.
Yes.
Yes.
If the person is not unconscious,
in a
yet,
coma.
they're going to be very
Yeah.
confused. Yeah. E, fruity breath.
Yes.
Yeah. What does
Yeah.
that fruity breath come from?
High
Okay.
sugar.
Elevated glucose.
Elevation of what?
Sugar in the
Elevated
blood.
glucose.
Yeah, very good. All right. So which of the following are manifestations of hypoglycemia? Another select all that apply. So with hypoglycemia, do we have A, increased urination?
No.
No.
No, that comes with hyper, right?
Yep.
B, hunger.
Yes.
Absolutely.
Yes.
C, poor skin turgor.
Yes.
No, we don't see.
You're not
poor
gonna be, because that's
skin
dehydration, right?
turgor. Right. D, irritability.
Yes.
Yes.
Okay. E, sweating and pallor.
Yes.
Yes.
F, Kussmaul respirations.
No.
Yeah,
Where do we
that's
see Kussmaul respiration?
hyperglycemia?
Yeah, we see that with our DKA, which we
DKA,
just
yeah.
covered was hyperglycemia. Very good. Oh, hunger, irritability, sweating, and pallor. All right. A nurse is teaching a parent of a child who has pediculosis capitis. What is pediculosis capitis?
Lice.
Lice.
Yeah.
Ooh,
Which of the following instructions should the nurse include in the teaching? A, apply mayonnaise to the affected area at night. B, treat all household pets. C, use an OTC medication containing 1% permethrin. D, discard the child's stuffed animals.
A,
C.
B.
C is our best answer. A is one of those old wives' tales.
Like a home remedy.
Exactly. Not saying it doesn't work. I'm sure it sufficiently suffocates the lice. Probably not something that the nurse should be recommending. Treat all household pets. I mean, I guess there's potential for that, but the pets weren't what caused this, right? Discard the child stuffed animals. Like we covered when we went over this in class, we don't have to throw things away if there's a way to clean them, right? If we're looking at linens, blankets, stuffed animals, if we can throw them in the washing machine, hot water, we're probably going to be able to kill those. The other thing that is not on here, remember, we want to repeat that treatment about a week to 10 days later, just to make sure that we got the lice at all stages, okay? How do children get lice? Where does it come from?
From others.
Yeah, the contact like a
sharing
brush or
beds.
Yeah,
pat.
it's not just
Pat.
going to jump if they're sitting next to a child with lice, unless their hair is actually touching. The potential of getting it that way is very minimal. Typically happens when we're sharing brushes, sharing blankets, laying on pillows, wearing hats of children that have lice. They're not going to, if they're just sitting in probably regular placement in a classroom, the lice is not going to jump from one individual to another. There has to be more contact for it to happen. Okay. All right. A nurse is caring for a child with contact dermatitis from poison ivy. Which of the following actions should the nurse take? This is another select all that apply. So A, remove the clothing over the rash.
Yes.
Why do we want to do that?
Because it's irritating the rash.
Yeah,
I say
absolutely.
keep it from itching it, but
I mean, those are one and the same, right? And we also have the potential for spreading, our shirts, our clothes move
yeah.
around a little bit when we're wearing them, especially if we're scratching. So we actually could spread the oils from that poison ivy to other parts of our body just simply from our clothes. Okay. B, initiate contact precautions while the rash is present.
Yes.
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 That one's a little tricky. Once the oils have been washed off, this is not contagious. It
No.
really just becomes the effects of the dermatitis that's going on. Okay. C, expose the rash to a heat lamp during 15 minutes. Or 4
No.
No.
Now, that's not going to do anything. It's probably only going to irritate the skin further. C, cleanse the affected area with a hydrogen peroxide solution.
No,
Why do we not want to do that?
because that's irritating. It's acid.
It's irritating, and it's also going to break down the skin. If we actually have healing going on with that area, if we pour hydrogen peroxide on it,
It'll make it
we
worse.
destroy all of that. Absolutely. E, apply calamine lotion to the skin.
Yes. 'cause
Yes.
it's
Yes.
What is that going to do for the child?
Help
Soothe
the
it.
itching.
and the inflammation.
Absolutely. It's soothing, and it may help with that itch as well. Very good. Not listed on here is going to be about that whole concept of preventing secondary infection through scratching, right? All right. A nurse is caring for a child who is in a plaster spica cast. Which of the following actions should the nurse take? A, use a heat lamp to facilitate drying. B, avoid turning the child until the cast is dry. C, assist the child with crutch walking after the cast is dry. D, apply moleskin to the edges of the cast. What's our best answer?
B.
C.
B.
Where's our spica cast? Oh, it doesn't really say.
It's the torso, isn't it?
Yeah, that's where it does say spica cast. Yeah. So this is, what are we trying to fix? Anybody remember what we're trying to fix with our spica cast?
Spinal.
What is hip
Spiderosis.
The hips, the hip dislocations, right? That DDH. So we said one of the safety points with that spica cast is that the child should not walk in it because the legs are splayed out like that. If that child walks while he's in that cast, it's actually going to make his problem worse. So we don't want the child to walk. Okay. Heat lamp, potential for burning. That's not a good idea. Because the spica cast goes all the way around, we actually are going to have to turn this child during that process so that the cast will dry. Okay. So we do have to rotate that child through that process. If you didn't know what moleskin was, why would you assume that D is the correct answer?
Well, that's a protective material so that if the child moves, it doesn't cut his skin or create a rash or issue.
Right, absolutely. So remember, when we have a cast, one of our priority actions, regardless if it's spica or whatever, the biggest thing that we're looking at is circulation and skin integrity.
I thought the
So-
spica cast was plastic.
It's plaster.
Oh, I thought it was, okay. Because I thought in the book, it said it was plastic.
I mean, there may be different types, but this one is specifically
Okay.
asking you about a plaster one.
Gotcha.
Okay. So if you didn't know that, hopefully you'd be able to work yourself through those. You probably got yourself down to B or D. But because big things we're looking at are circulation and skin integrity, hopefully that would lead you to D, even if you didn't know what moleskin is. But like Brian said, it's just a protective material. All right. A nurse is caring for a child following a fracture. Which of the following actions should the nurse take? This is another select all that apply. So A, place a heat pack on the site of the injury. Yes or no?
No.
No.
No,
Do
that's
ice.
not going to help.
Or
But
no.
ice would be much better, right? B, elevate the affected limb.
Yes.
Why do we want to do that?
swelling.
The rice method.
Yeah, you both nailed it.
Circulation.
Yeah, it's
maybe.
going to help that circulation and limit our swelling. Very good. C, assess the neurovascular status frequently.
Yes.
Yes.
What are we looking for here?
Blood
Like,
flow.
yeah.
Blood flow, absolutely. Remember, we talked about those 6 Ps, right? Paresthesia, paralysis, pain, all of those factors could indicate that we've got a problem going on. Either our nerves are being affected, maybe we've got a lack of circulation. So we're going to assess that very frequently. D, encourage range of motion of the affected limb.
No.
No.
No, what do we want for this limb?
Stabilized.
Mobilized.
Stabilized, yeah.
Right,
Yeah.
absolutely. We want it to heal. E, stabilize the injury.
Yes.
Yeah, that ties in with D. We want it to be elevated, but we want it to be still so that it can heal. Very good. All right, which of the following are manifestations of a fracture? This should say select all that apply. So we have a fracture. Are we going to hear a crepitus?
No.
No.
What's
Well,
crepitus?
Like the
It's like that
Yeah.
popcorn
The Rice
sound.
Krispie.
That popcorn sound. It almost
yeah, like a crackling. I
like
guess.
bone
Which we
fragments.
could hear,
Yeah.
if we've got bone fragments or we've got a fracture, we may hear crepitus because it's that air moving around it. So actually, we would hear crepitus.
Okay.
Okay. B, edema.
Yeah.
Yes.
Yes, that's that inflammatory response. C, pain.
Yes.
Yes.
D, fever.
No.
No.
E, ecchymosis.
Yes.
Yes.
What is
Mhm.
ecchymosis?
Bruising.
Bruising.
Yeah. All right. A nurse is caring for a toddler with hip dysplasia and has been placed into a spica cast. Which of the following explains why this is the mode of treatment and not the Pavlik harness? A, the Pavlik harness is used for children with scoliosis, not hip dysplasia. B, the Pavlik harness is used for school-aged children. C, the Pavlik harness cannot be used for your child because her condition is too severe. D, the Pavlik harness is used for infants less than 6 months of age.
A.
A.
So that's not true. The Pavlik harness is used for hip dysplasia. Scoliosis, we're going to, if it's severe, we're doing surgery. Otherwise, we're doing bracing.
Because the harness is used for infants less than 6 months.
Yeah, so D's our best answer. C is potentially an answer as well, but if we're looking at the biggest reason that the Pavlik harness is used, it's because we're looking at that newborn or that infant, that early infant. Okay, once the child gets more mobile, we have to have that Pavlik harness in place because we need to prevent movement more aggressively than we did. We also may have tried the Pavlik harness. If that didn't work, we may have to advance to the spica cast. That's where C is a little confusing. Okay. All right, so points to remember, signs of increasing ICP in children and infant. Remember, you want to be able to differentiate between those two, what you're going to do about increasing ICP. When we talk about submersion injuries, what did we say indicates the increased likelihood of having a positive prognosis? We had 4 questions that we wanted to think about. What were
Clean
they?
or dirty, hot or cold, and if they use resuscitation
Yeah.
or how aggressive the resuscitation.
Yeah, so we want clean versus dirty water. Clean is less likely.
How
to
long
give
they've
us an
been
infection.
underwater.
Very good. That's the last one. The other point is warm versus cold water. Cold water is going to do a better job of bringing down that child's temperature, which means less blood flow to the brain, less potential for injury or permanent injury, less amount of time under the water. So less than 4 minutes is a better prognosis. And then, like Jessica said, not needing resuscitation, being responsive at the scene is going to give best prognosis as well. Okay. Looking at those indicators for cerebral palsy, autism spectrum disorders, Down syndrome, go back to our lectures there. and then priority actions following a head injury. We covered that with that question. You guys talked about, I mean, it's always ABCs. Beyond that, for head injury becomes that protecting that spine to make sure that if there is an injury, we don't make it worse. And then we move on from there. If we've got a laceration, something's bleeding, we want to stop that. But always ABCs, and then stabilizing that spine for a head injury. All right. I've never had an entire class period to go over everything. So that definitely could be longer, but don't worry. I have more questions. We're going to go through some prioritization next, but let's take a 13-minute break. We'll come back at 8:30 and we'll do some more practice questions. Okay. Okay, for these questions, we're going to look at prioritization of care.
Janet, I
They're gonna-
have one
Do
question.
you have a question? Sure.
Yeah, juvenile arthritis.
Uh-huh.
It wasn't any of your questions, it was on juvenile arthritis, but I'm just wondering, it's just gonna be care and treatment of that, correct?
Yeah, focus on your education, what you're going to tell the parents.
Okay,
So these questions are going to jump around as far as the content. I did have some in mind for exam 3. We didn't have time to go through, and we have time now. I would focus less on what condition is being talked about, especially when we're talking about exam 3, and more just think about it as prioritization, because whether we're talking about that condition or not on exam 4, it's still going to help you as far as some of the questions that you may see. Okay. All right, so let's look at the first one. All right, the 6-year-old client who has undergone abdominal surgery is attempting to make a pinwheel spin by blowing on it with the nurse's assistance. The child starts crying because the pinwheel won't spin. Which action should the nurse implement first? A, praise the child for the attempt to make the pinwheel spin. B, notify the respiratory therapist to implement incentive spirometry. C, encourage the child to turn from side to side and cough. D, demonstrate how to make the pinwheel spin by blowing on it. What's our best action?
A.
Yeah, Jasmine, why is it A? Why is that the
Because
best
you
thing?
want to make the child feel good about themselves for trying at least.
Yeah, we have to think about Erickson, right?
Erickson's,
Exactly. It
yeah.
always comes back to Erickson. If we think about what this 6-year-old is thinking about, he's trying to please you as the nurse to get this task. He doesn't really think about the whole physiology of what he's doing for his body. None of that matters. You, an adult, asked him to do something, and he wants to do that for you. So obviously we want him to be able to do it because it's going to help his lungs. But the first thing that you can do, or first thing you need to do, is like Jasmine says, we need to praise this child because he tried, right? He gave the effort. We're not going to jump into, I mean, if he's not able to make the pinwheel move, the ability for him to do the incentive spirometry effectively for it to help his lungs is probably not going to work either. So we want to praise him for trying, and then try to troubleshoot. Maybe we could teach him or show him some other ways to try to make it work. Very good. All right, the nurse is caring for clients on a pediatric medical unit. Which client should the nurse assess first? A, the child diagnosed with type 1 diabetes who has a glucose level of 180. B, the child diagnosed with pneumonia who is coughing and has a temperature of 100 degrees Fahrenheit. C, the child diagnosed with gastroenteritis who has a potassium level of 3.9. Or D, the child diagnosed with cystic fibrosis who has a pulse ox reading of 90. Which one is our priority?
B.
Is that B as in boy or D as in dog?
D is in dog.
Very good. What are we thinking there?
Cystic fibrosis and the O2
Oxygen.
levels.
Absolutely. We're thinking about our ABCs. We're thinking about his oxygenation. 90%, we know cystic fibrosis has a big factor on our lungs. We may have some mucus that's preventing us from moving that air. which means that our problem is only going to get worse. So we have to intervene with him first. Very good. All right, the nurses received the morning shift report for clients on a pediatric unit. Which medication should the nurse administer first? A, the third dose of an aminoglycoside antibiotic to the child diagnosed with MRSA. B, the IV push steroid methylprednisone to the child diagnosed with asthma. C, the sliding scale insulin to the child diagnosed with type 1 diabetes. Or the stimulant Ritalin to a child diagnosed with ADHD. Which one's our priority?
B.
I say B.
All right, Cheryl says C. Why is it C, Cheryl?
Just because you don't know what their blood sugar is, so you want to see them first. You might need to give them something, and they're
The
gonna
fact
tank.
that it says sliding scale should give you a big red flag in your brain that if we're giving sliding scale, our blood sugar is not normal, right? Because
Mhm.
typically if we have sliding scale, we've got our regular dose, right? We may have other insulins that we're giving, but we've got our regular dose of regular insulin that is just scheduled every morning or every meal. If we're giving sliding scale, this tells me that I'm abnormal. My blood sugar was not normal. Okay. The other reason that we're going to lead towards this one rather than the Solumedrol for asthma is because that is a long-acting medication. It is not going to be an instant fix, which tells you that that child is not in crisis. That Solumedrol is a long-term medication that's not going to do anything if that child is in an asthma crisis at that moment. Does that make sense?
I also just thought though, like I wouldn't want to give the sliding scale or the insulin coverage until I know they're going to eat or something more of that context. That's why I
But
didn't.
now you're reading too much into the question.
Yep, always do.
Yeah. All right, the 3-year-old has been admitted to the pediatric unit. Which task should the nurse instruct the unlicensed assistive personnel to perform first? A, orient the parents and the child to the room. B, obtain an admission kit for the child. C, post the child's height and weight at the head of bed. D, provide the child with a meal tray. What's our priority action?
A.
Why is it A? Who said?
A.
You want to show them around, let them know where everything is, kind of thing.
Yeah, how does that help?
Less questions.
Well, yes, but if we think about
It
that,
makes them feel more comfortable after
there
being
we
admitted.
go. Very good. We look at that anticipatory guidance. We look at making both the child and our parent feel more comfortable in the situation, more likely to trust us, more likely to listen, to do whatever it is that we all need to do for that child's health. This is the best thing that we can do in that environment. Very good. All right, the clinic nurse is preparing to administer an IM injection to the toddler, the 2-year-old toddler. Which intervention should the nurse implement first? A, immobilize the child's leg. B, explain the child to the procedure. C, cleanse the area with an alcohol swab. D, administer the medication in the thigh.
B.
B is in boy. Very good. He's 2. We're going to have to explain it in a way that he understands. Is he still going to fight us? Absolutely. Is he probably used to getting lots of injections? If he remembers much of his first year, absolutely. He's going to know what's going to happen. If we hold that child down before we start explaining, then he's just going to be upset from the minute. So whether he really understands or not, we want to give him that choice or that opportunity to understand in a way that's going to be most likely that he can understand. Okay. All right. The nurse is writing a care plan for the 5-year-old diagnosed with gastroenteritis. Which client problem is the priority? A, imbalanced nutrition. B, fluid volume deficit. C, knowledge deficit. Or D, risk for infection.
B.
Crystal says B. Why is it B, Crystal? What's your thought process here?
Dehydration is more likely.
Yeah. And what is that going to affect?
That is-
How do we tie that back into our ABCs?
Circulation.
Very good. Good job, Jasmine. All right. Which data would warrant immediate intervention from the pediatric nurse? A, proteinuria for the child diagnosed with nephrotic syndrome. B, petechiae for the child diagnosed with leukemia, C, drooling for a child diagnosed with acute epiglottitis, or D, elevated temperature in a child diagnosed with otitis media?
I would say C.
Okay, C, right? We expect the child to have proteinuria with nephrotic syndrome. We know that petechiae is a possibility with leukemia. We expect the child with an ear infection to have an elevated temperature. What does C tell you about this child? He's drooling, he's got epiglottitis. What's going on here?
Swallowing.
He can't
Issues?
breathe.
He
Yeah,
can't
okay.
breathe. His problem is
Yeah.
getting worse. Very good. All right, what client should the pediatric nurse assess after receiving the morning shift report? Should say assess first. She's going to assess all of them, or he's going to assess all of them. But which one should we assess first? The 6-month-old child diagnosed with bacterial meningitis who is irritable and crying. The 9-month-old child diagnosed with tetralogy of Fallot who has edema of the face. C, the 11-month-old child diagnosed with Rye syndrome who is lethargic and vomiting. D, the 13-month-old child diagnosed with diarrhea who has sunken eyeballs and decreased urine output. Who's our priority?
D.
Brian, did you say D is in dog or
Yeah,
B is in boy?
The dog.
Why is that one your priority?
That's
What do you think in
basically,
your area?
that's volume depletion.
Yeah, absolutely.
So they're in greater crisis for neuro issues.
Very
and-
good. Absolutely. And our circulatory volume is a big thought process there as well. Very good. All right, so now we'll move on to some questions more closely to our content that is going to be on your test tomorrow. All right, the nurse is working in the ED of a child's medical center. Which client should the nurse assess first? A, the 1-month-old infant who has developed colic and is crying. B, the 2-year-old toddler who was bitten by another child at the daycare center. C, the 6-year-old school-age child who was hit by a car while riding a bicycle. D, the 14-year-old adolescent whose mother suspects her child is sexually active.
C.
C.
C, yeah, what are we thinking? What's our priority thought for C? Why is he the most important?
Head
Neuro-
injury.
Head
Respiratory.
injury, very good. Or potential for head injury, I suppose we should say. The 8-year-old client diagnosed with vaso-occlusive sickle cell crisis is complaining of a severe headache. Which intervention should the nurse implement first? A, administer 6 liters of oxygen via nasal cannula. B, assess the client's neurologic status. C, administer a narcotic analgesic by IV push. D, increase the client's IV rate.
B, assess neurostatus.
What are we thinking?
I see.
Oh, like a stroke kind of.
Yeah.
Absolutely. We know with vaso-occlusive, our big risk factors are stroke and that acute chest trauma that we talked about, right? If we're complaining of a headache, the first thing that we want to think about is potential neurologic changes. We don't necessarily, I mean, we've talked about how pain is associated with sickle cell, but it's not necessarily just specifically in our head. That is why when a child complains of headache, we want to be more clued in that it's something beyond just the pain associated with sickle cell. Very good. All right, the pediatric clinic nurse is triaging telephone calls. Which client's parents should the nurse call first? A, the 4-month-old child who had immunizations yesterday, and the parent is reporting a high-pitched cry and a 103-degree fever. B, the 8-month-old child whose parent is reporting the child is pulling on the right ear and has a fever. C, the 2-year-old child who has a PDA whose parents report running out of digoxin. D, the 3-year-old child whose mother called and reported the daughter may have chickenpox.
A.
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 What do you think is going on with this child?
Infection.
Reaction.
Yeah,
No.
infection. That high-pitched cry tells you what?
A neuro cry.
Yeah, that's a neuro cry. That means that, 103, we most likely have an infection. That neuro cry is telling you that increased ICP may also be a factor here That's what makes them priority. B, we've got a likely ear infection. C, definitely something that we want to take care of. We want to get that prescription refilled, but they're not out yet. That means that's not our priority. May have chicken pox. I mean, most of that's supportive care anyway, so may not even need to see that child. So A is our priority. Very good. All right. The parents of a 12-year-old male child with a left below the knee cast calls a pediatric nurse and tells the nurse, my son's foot is cold and he told me it feels like his foot is asleep. Which action should the nurse implement first? A, prepare to bifurcate the left below the knee cast, which means to cut it open. B, tell the parent to bring the child to the office. C, instruct the parent to elevate the leg on 2 pillows. D, notify the child's orthopedist of the situation. What's our
D.
priority?
I would say D.
Don't you want to elevate it first?
C?
Yeah,
C.
elevate is our correct answer.
Yeah, C.
We obviously have a circulation issue, right? That we've got poor circulation, the foot is cold. He's complaining of that paresthesia, that pins and needles. We may be able to fix this by simply elevating that leg. If we try that and that doesn't fix the situation, now we need to bring that child in. We need to see what's going on. It may be that the child has a bigger issue. If he also said that his foot is cold, he feels like it's asleep and it's causing him pain, now I'm thinking potential compartment syndrome, and that would lead me more towards A, or getting that child to be seen immediately. Okay. All right, which child requires the nurse to notify the healthcare provider? A, the 1-year-old child with iron deficiency anemia who has dark colored stool. B, the 3-year-old child with PKU whose parent does not feed the child any meat or milk products. C, the 5-year-old child with rheumatic heart fever who is having difficulty breathing. D, the 7-year-old child diagnosed with acute glomerulonephritis who has dark tea-colored urine.
C.
C is our best answer. Immediately we go to ABCs, right? But other things, we expect that dark colored stool, right? He's most likely on iron, right? We expect that. With B, the child or the parents shouldn't be feeding that child any meat or milk products. Those are dietary eliminations that we have to do. So that's a positive finding. And then that dark tea-colored urine is an associated symptom with AGN, so not something that we need to report either. Okay, very good. All right, the pediatric nurse on the surgical unit has just received morning shift report. Which client should the nurse assess first? A, the 3-week-old child 1 day post-op with a surgical repair of a myelomeningocele who has bulging fontanelles. B, the 3-month-old child 2 days post-op temporary colostomy secondary to Hirschsprung's disease who has a moist pink stoma. C, the 9-month-old child with a cleft palate repair who is spitting up formula and refusing to eat. D, the 4-year-old child 1 day post-op for a repair of hypospadias who has clear amber urine draining from indwelling catheter.
A.
Absolutely.
A.
What's going on with A?
The bulging
Overhydration.
ICP.
Overhydration or
ICP.
increased ICP would be a huge concern. Absolutely. So that's the priority. B is the normal finding. We want to see a healthy stoma. So that's perfect. D, clear amber urine. I mean, what better picture could we see to tell you that his repair of that hypospadias is moving towards the right direction? Hypospadias we didn't talk about, but it's just placement of the opening, the urethral opening on the penis. C is concerning. We definitely want to look into that. But that increased ICP is going to take our priority. Very good. All right, a nurse's planning pre-op care for a child diagnosed with Wilms tumor. What is the nurse's most important intervention? A, prepare the child for the initiation of chemo and radiation. B, insert a nasogastric tube for enteral feedings. C, avoid abdominal palpation or manipulation. D,
B.
begin IV therapy of hyperalimentation and lipids.
C.
C, we know that one's C. Very good. Okay. So that, we went through those questions pretty quickly. That is the end of the questions that I have, but we have 20 minutes left of class. So if you guys have any specific questions, I'm happy to answer those now. Anything, I didn't realize there was someone in the waiting room. Anything that you are confused about, you want more direction on, anything like that, I'm here to help however I can.
I have one more question on about the thyroid disease children. Number 7, it says the most common thyroid disease in children and adolescents. I put A because the book says it's A, but the answer I think on the review says it's B. Is that right?
Go with what your textbook says.
Okay.
Yeah.
All right. Thank you.
I'm not dismissing you guys. If you leave now, it's going to affect your attendance. Just so you know.
The normal hemoglobin for 1 to 6 years old is 9.5 to 14, correct?
Yes.
Okay, and you said we need to know white blood cell count as well for this, right?
Mhm.
Which you said was 45,000 to, I remember, 45,000 to 100 and something?
Yeah. Just know that if you're seeing lab value questions on the exam, it's going to be egregiously high or low. It's not going to say like, 44,000 to really make you question. It's going to be something that's very obvious.
Okay, got you. And don't give milk to kids that are under 12 months of age, right?
Right.
Because that is not iron fortified. And
Yeah,
want
we
them
want
to
them
iron
to have
fortified.
formula or breast milk for that first year. Once they hit their first birthday, then we can come off the formula and we can start doing whole milk.
Okay,
When did you say it was okay to implement iron?
We talked about for the breastfeeding only moms. We want that child to be on an iron supplement by 4 months of age. By that point, he has worked through all of his iron stores in his little body, and he's going to need some supplementation because breast milk is not high in iron.
Gotcha.
Did that answer your question?
Yes, ma'am.
Great.
and aplastic anemia usually follows a viral infection, is that correct?
Mhm.
And we're mainly worried about stroke when it comes to anemia, correct? Like complications. Because there is poor perfusion, because the blood is very thick.
So,
Mhm.
yeah, in a generalized answer, yes. But when we're thinking stroke, we are going to most likely associate that with sickle cell anemia.
Okay.
Again, I'm not dismissing you. If you leave now, I have to take it off your attendance. I see some people posting in the chat. If you have to leave, I get it, but I still have to take that attendance off.
Miss Bennett, I sent you a message.
Who was that?
Kirsty.
Okay.
What is functional asplenia? Did I say that
Say
right?
functional what?
Asplenia, A-S-P-L-E-N-I-A.
Gosh, if I had to venture a guess, I would say that there is no spleen. The spleen
Okay.
was taken out. I don't know.
Okay. Yeah, it's for sickle cell. It's one of the questions. I just haven't looked it up yet. That's questioning. Yeah.
Well, if we're looking at sickle cell, remember one of our complications is that splenic sequestration. So if that's a situation that's going on, sometimes we do have to remove that spleen. That's the best that I can tie that into there.
Someone's asking about bacterial meningitis in the chat.
Is there a specific question about the bacterial meningitis?
There is. I was asking if we have to go in depth about like the different types. I know one of them is going to be because it was asked about the WBCs. So neutropenic precautions, anything less than 45 for WBCs. So I was trying to look it up, but I was going through the book and
You have to know like positive Kernig sign and Brudzinski sign as evidence of meningitis, correct?
Yes, but you don't have to go. I mean, there are many types. We focus
Yeah.
more on bacterial meningitis, but I mean, there's so many more ways to break it down. You don't have to go that deep into it.
thank you.
And we have to get a blood culture first and then
Yes.
start the antibiotics, correct?
Yes, yes.
And that'll be a droplet precaution because it's airborne, right? I mean, it is airborne, but it's not airborne precaution. It's just droplet. For meningitis,
Right, yes.
okay. What priority teaching would you say you would recommend for meningitis?
The biggest thing is going to be about looking for those signs of increasing ICP.
Oh, okay, even for meningitis, okay.
Yeah, because remember we talked about meningitis. I don't remember if I shared I don't think I did. But we can see permanent brain damage related to untreated meningitis. So we want to be able to diagnose that very quickly. And then looking at aggressively treating it is going to be our big focus. When I worked in pediatric home care, I actually took care of a 7-year-old who was completely total care. Couldn't walk, couldn't talk, couldn't eat by himself, all because he had meningitis that mom did not like clue into.
That's gonna be like I mean, it's gonna be a medical emergency, but it's like the nuchal rigidity, the signs like that, the nuchal
That's our
rigidity.
huge red flag. Yeah.
Okay,
Or pain when they turn their neck. Absolutely.
okay.
You said for ICP, we need to focus on positioning, cluster care, mannitol, isotonics.
Like decreased stimulation too, right?
Yeah. Mhm.
What'd you say?
Decreased stimulation?
stimulation.
Decrease. Oh yeah, like for cluster care. Yeah.
Clustered care, quiet, dark environment, not a lot
Low
of people in
dim.
the room. Mhm.
Okay.
Like limit visitors for also them and bacterial meningitis kind of thing. Is that too?
Yes.
Just okay. Oh, and neutropenic. Oh, we need to know the positioning, right? Like the flexion and the extension, like the decorticate.
Yes, the difference between those. Yes.
Oh.
Great.
You also said there's gonna be a picture of scoliosis.
Oh, yeah.
All
Is
I
it-
know is
Say, I didn't
DCD is
say
the
that.
N-word.
Sorry, let me repeat that. You said part of our focus review should be on signs and symptoms of scoliosis or the visual indication of that, correct?
Yes, I did say that.
Okay, gotcha.
Sorry to go back to ICP, but we did say for the solution, if we're doing IB or IB solution, it's just going to be like a normal saline formula.
If we're dealing with increased ICP, we're actually going to give an isotonic solution because we want to pull that fluid out.
Okay.
For, I'd like to go back to scoliosis for a minute.
Sure.
Pavlik or, what other harnesses are used to correct that besides surgical?
So Pavlik harness has nothing to do with scoliosis. Pavlik harness is about about hip dysplasia.
Okay, I'm getting confused of the harnesses.
Yeah.
They
And
do
for
do some-
scoliosis, we didn't
Okay.
name, I didn't give you a name for a specific cast, or
Okay.
sorry, a specific brace.
Okay, so don't worry about braces for scoliosis, just worry about signs and symptoms, what it would look like.
Mhm.
And how do we need to know like how we test for it or like what we see with, right? That's on that picture. Like that's the same, almost the same as like the testing, right? When they bend over with the arms hanging all the way down.
So we're looking for that lateral curvature and actually spinal rotation.
Twisting, okay.
Oh,
So if it were me and I were preparing for this, I would be able to identify, all right, this spine looks like lordosis. This spine looks like kyphosis. This spine is normal. This spine is scoliosis. Being able to pick out each of those will be very beneficial to you.
and
Scoliosis is like a S-shaped spine, right?
Yes, ma'am.
the differences are the degrees of the curvature, really, that differentiates them, correct?
Well, lordosis, kyphosis, those are completely different situations.
One of them is like right here at the hump, and then one of them is like to the like
Yeah,
just
so-
particularly to the side,
So
kind of right.
kyphosis, you want to think of your little old lady. who
Yes,
has that
yeah.
hunchback.
Yeah.
For lordosis, you
lordosis.
want to think about your pregnant lady who
Oh
has
yeah,
that
it's like kind of
curve.
out. Okay.
Mhm.
Okay.
Because her body is trying to compensate for that extra weight. Scoliosis, think S. Because we've got two issues, lateral curvature and spinal rotation.
You know, shortness of breath for the sign of school, like just the pictures, right? You're saying focus on. Okay.
I'm saying be able to visually
Didn't say
identify.
that.
She said y'all doing too.
Y'all don't put words in my mouth that are gonna get
You're
me
not
in
getting her in
trouble.
trouble.
That's what I meant. My words are just awful.
Yes, our words are awful. We don't mean anything by any of that. On the record, yes.
Do we need to focus on the diagnostics tests like lumbar punctures for meningitis, MRIs for other things? Do we need to focus on that?
Or like the chemo, like intrathecal chemo, anything like that.
No,
Okay,
as far as chemo, the biggest thing that you want, I mean, there's so many ways that we could go way too deep into this. You guys really just need to be familiar on those complications of chemo and what you're gonna do about them.
Like the nausea, vomiting, the hair. Okay.
What about the ventro something catheter?
The VP shunt, is that what you're talking
Yes,
about?
the shunt.
Yeah, so remember with the VP
Okay.
shunt, that is how we are going to correct hydrocephalus. Right, we've got too much CSF or poor drainage of our CSF. Two big complications there are infection, which I mean, it's gonna look the same as infection anywhere else. Or shunt malfunction, which means that that shunt is not draining effectively. And if we have shunt malfunction, what we're going to see is all of those signs of that increased ICP come right back. So if we're working with an infant, that bulging fontanelle, that increased head circumference, that neurocry, all of that setting sun reflex, all of those things, if our shunt is not working correctly, we're not able to facilitate that drainage, we're going to see all those increased ICP symptoms come right back.
They wouldn't go home with a shunt, would they?
Oh yeah, it's a
They
permanent
would.
thing.
A permanent. So you're teaching the parents about signs, symptoms of ICP increase.
Mhm.
On the bone cancers, like do we need to know specifically? I know one's for the long shaft and the other one is for the bone marrow or the
Osseous
do I need
tissue.
to know like the specific wording of those to differentiate?
Yes, you do.
Okay. The Ewing's and then the osteosarcoma, right? Different, okay.
Mhm.
For autism, muscular dystrophy. Shoot, I can't remember the other one. Autism, ADHD.
Mhm.
Those kind of behavioral things.
Yeah, so for those, you want to focus on the things that are specific, right? So with
Okay.
ADHD, we talked about how a big factor is the inability to really pay attention for a long period of time. That
A low stimuli
distraction
environment for that kid,
is a huge
right?
issue.
Low stimuli environment, clear direction, simple tasks, that kind of thing,
And
right?
frequent breaks for
And
ADHD.
frequent breaks. Okay. And then autism, one of the main signs and symptoms to indicate autism will be the child does not speak back to you or respond.
And eye contact is another big one.
Or just like repetitive movements or
Yes,
words.
repetition is another big one. Yeah. So it really comes from that lack of social interaction, and those repetitive movements are two big red like categories. And then the best thing that we can do for children with autism spectrum disorders is to maintain their routine as much as possible, and consistent caregivers as well.
Or like if they're coming to the hospital, we're gonna teach, like we would teach parents, like bring something that comforts them from home, right? Or
Yeah,
make
if
it
there's
like
something, if there is a
home.
blanket that they cannot sleep without, we must have that. Whatever that child, I mean, the parents and the caregivers are going to be the best people that tell you what this child needs. If he eats every day at 11:30, that's not something that we're going to deviate. We will literally plan our treatment around what his needs are, because that is going to give us the best scenario to treat him.
And we place them in independent or personal rooms too, like
Yeah.
unless they can it indicates they can tolerate the
Yeah.
care, right?
I mean, it's a spectrum disorder. So there are going
Okay.
to be different levels. There may be some level of interaction that child needs. That's something that the parent or caregiver can help you decide. We don't want to keep him in his room the entire time. We want him to be able to go out to that playroom, but we want to do that at non-peak times, because that overstimulation is not going to be good for him.
And the Down syndrome, the biggest red flags would be the depressed nasal bridge, the protruding tongue, and the upward slanted eyes.
Yeah, and the neck, the short neck is also a big finding.
Oh, short neck.
Short stubby digits too, right? Or okay.
Yeah, just kind of think he's squished. Everything's pretty compact.
What about like the protruding? Is it protruding tongue?
Mhm.
Or like it's not protruding tongue. It's like their mouth is
Yeah,
smaller.
you do see a protruding tongue, but it's because the mouth is small. It just makes, it's not so much that the tongue is large, it's that the mouth is small.
And the most difficult, a risk complication would be for cardiac issues with this kid, correct?
50% of babies or children with Down syndrome have cardiac complications, with that VSD being the most common.
Would the nursing care like consideration be like our ultimate goal is to like achieve as normal functioning or independent functioning as possible?
Yeah.
Okay.
And remember, for all of these, whether we're talking cerebral palsy, Down syndrome, autism, ADHD, our biggest goal is early diagnosis, early treatment, because regardless of which pathway we're looking at, all of those are going to give that child the best chance of putting him at his highest level of functioning.
What about, do we need to know like Hodgkin's disease or non-Hodgkin, like the specifics of those for the leukemias, right? Or
No, just focus on AML.
Okay.
I'm sorry, ALL. Focus on ALL.
Not AML, ALL.
Not AML. ALL. Yeah.
Because that one has the highest part.
Mhm.
Right?
Okay, now if you're ready to end class, if you don't have any more questions, you're welcome to head on out. But I can say, if you guys still have questions, I can say.
So ALL has the highest chance of life.
Life.
Yeah,
Of
our
survival.
highest survivability. Yeah, best prognosis.
Okay. Oh, what were the 3 things you said about submersion injuries?
So it's
Again?
four actually.
I
So
missed the
cold,
thread.
okay, that's okay.
Okay.
So cold water is better than warm water because it
Okay.
decreases the body's circulation, which means less potential damage to the brain.
Okay.
Clean water is better than dirty water because less potential for infection. Decreased submersion time is best, less than 4 minutes, gives you a better prognosis. And then little to no resuscitation necessary. So, I mean, the less is better on that. We want the child responsive at the scene. Those 4 things all go into the best prognosis for that, for submersion injury.
Okay.
So you'll think about their ABCs though, if they come in conscious or well, unconscious.
Yes.
Okay.
Well, if they come in conscious, they obviously have a better prognosis just off the bat.
True.
Right. Right. Okay.
You didn't really talk about, I know we need to like focus on like the child's response, specifically like infant, toddler, preschool, school age about death and dying, right? Or like their response to it.
What's your question?
For the death and dying, like we need like for each like infant,
Erickson's.
toddler, yeah, we need to know their response to the death.
Right. Like school age
That's-
children have a better response, better
Yeah.
understanding.
Infants,
Most.
toddlers. You're talking about that chart. on
Yeah,
the
I mean,
guide.
basically you
Yeah.
need to know that chart very, very
Yeah.
well because it's about the child's response, but also what you, the nurse, are going to do about it.
What about I remember one question about the dying child specifically, like they're gonna be like, is it school? I think it's school age, like where they're gonna be like, are my parents they're more concerned like if their parents are going to be okay once they're gone, right?
Mhm.
Okay, instead of kind of like the other way around, like they're worried about leaving their parents, right? They're more like leaving parents means like, are my parents gonna be okay?
Yeah, because they get that distinction that this is a permanent thing. They
Okay.
will be separated from their parents.
Okay. Okay, thank you.
Okay. Brian, what else you got?
Hold on. Don't
I'm
go.
dead. I'm gonna stay for Brian questions. 'Cause he got-
Yeah, me too. I'll stay
Why?
right there.
Why you all want to stay with my mom still? Because you know I asked for it. So,
You guys are
you're all on because of me. I'm keeping you because of them.
Hey, the more knowledge, the better.
I'm serious. I gotta get a 90 on this. No question.
You will, you will. What about skin
Oh.
disorders like the eczema, is it about eczema or
Oh, yeah.
psoriasis?
Human bites are the worst kind of bite.
Yeah, well.
Why
or
is that, Brian? Why is a human bite
Because-
worse?
Because we're full of infection.
We're
I mean,
dirty. Yeah.
we're dirty, yeah.
Dog bites wouldn't be worse, though.
No, it says
No, our
human-
mouths are
Really?
disgusting. They're
Okay.
way more, there's way more bacteria in our mouths than in the dog's mouth.
Okay, good to know. Thanks, Brian.
Yeah,
They-
so priority,
Yeah, that could be
whether
awesome.
it's animal or dog, priority is gonna be about cleansing that area to try to prevent infection,
Okay.
especially if the skin is broken. If we're talking about animals, big thing that you want to focus on is the teaching of the child to be safe around the pets. Even if it is a pet in your own house, you know the dog, there's always that risk, if we catch that dog when they're not paying attention. So we want to be mindful. We always have to, as parents or caregivers, we always have to be watching the interactions between the two of them because a dog can snap like that. Even the sweetest dog,
Like around feeding
if,
time,
if
right?
pushed by that little
Mainly when they're
toddler,
eating, right?
Yeah, eating,
Um,
like around eating time, yeah.
around
to
eating
Last
or
quarter-
catching them when they're sleeping.
Yeah, that was my
Yeah.
question. Because
Yeah.
I got caught up on that last quarter. Like, okay, so one one's eating and then one's sleeping. So which one would be more of a priority? The sleeping dog
Sleeping,
or
would be sleeping.
What it ultimately boils down to is that dogs, I mean, they're reactive, right? Or
Right.
animals in general are reactive. If they are disturbed in a situation that they're not familiar with, rather than try to, work through the situation, they're going to attack. That is their animal nature, is to protect themselves. So we're always mindful of our children when they're interacting with pets, but times that we want to be most protective of is if that dog is sleeping and the child goes over, if the dog is eating. Both of those are really important times to be careful.
like
okay, I got
safety
caught up
safety.
on that last quarter.
Because it's that with the sleeping, it's that unexpected thing. The dog just reacts to the situation.
What about cerebral palsy and getting a botulinum A injection?
I missed your question. What about it?
Botulinum A injections for therapeutic management of cerebral palsy. What is the connection there?
Oh, so botulism is a localized, essentially it's a paralytic, right? It relaxes, I guess I should call it a muscle relaxer. It relaxes that muscle. That's why if we do Botox in our forehead, it
Oh.
keeps things from creasing because it relaxes those muscles. So we can use Botox for localized, like if we've got a contracture related to that muscular dystrophy, it releases those muscles.
Okay. That makes sense.
And baclofen pumps are also like surgically sometimes.
Mhm. That would help for more systemic issues if we're doing a baclofen pump.
And to prevent neural tube defects, the best thing to teach is to take folic acid supplements.
Yes,
Right?
for all women of childbearing age.
Say that again, Brian.
To prevent neural tube defects, the number one thing
Oh,
is
folic acid.
folic acid supplements to the mom for the length of pregnancy.
It says all childbearing age women should take it.
Mhm. Yeah, because many women, they may know that they have the risk of getting pregnant, or they may be actively trying to get pregnant. What we're trying to focus on are those women who just end up pregnant, weren't really planning, didn't really know. If we have all women of childbearing age taking it, if women just get pregnant, then they're protected, or the baby is protected, because that neural tube closes. We're looking at early development by like 4 to 6 weeks. And most women, especially if they're not actively trying to get pregnant, they don't know they're pregnant.
Right,
Is,
accident.
yes. And I mean,
I'm trying to word it very
Angela.
carefully.
like end of childbearing age,
Makes
like
sense.
35 or right? You're considered geriatric pregnancy after 35? I know this is like,
Yeah, no, that's
but-
very hurtful, but yes.
Yeah. Okay, I'm not specifically saying nothing.
I know. It's terminology. It used to be advanced maternal age, and then they upgraded it to geriatric, and that is like some hardcore baloney. That's even
I don't
worse.
disagree with the word.
No, very mean.
Well, I want to thank you, Professor Bennett. You are an amazing teacher.
Thank
Keep doing
you.
what you're doing, because
I
it is.
agree. Thank you
helps
so
us.
much.
We may not say it enough to you, you may not hear it, but you are one of the best teachers here at Galen.
Thank you, guys. I appreciate that positive feedback.
Hey, and I don't know, Brian or anybody else, if anybody's asked, I did ask you about the AI conference. So are we supposed to we should have grades like pretty fast.
Oh yeah.
Oh, IA. I was like,
Oh,
AI,
whatever it's
what?
called.
Artificial intelligence. Oh,
And where are we going to take the exam? Where are we taking the exam?
Oh, we're taking it 116, right?
yes. Same
Okay.
room as last time.
Okay.
The call actually is tomorrow at 3:00, I believe. So you'll get grades tomorrow.
Oh
my God.
wow.
Okay. All right.
Ugh.
Thank you.
Okay,
All right.
I've enjoyed
See you
it.
all in the
Thank you.
morning.
you're amazing.
Thank you. Bye, guys.